Good day, colleagues. Today I would like to present a rare case of MiNEN of the lower esophagus. This tumor is exceptionally uncommon. The initial pathological diagnosis was incorrect. An extended immunohistochemical examination completely changed the diagnosis. Asa result. The treatment strategy also changed. This case illustrates the importance of expert pathology in rare gastrointestinal tumors. Before discussing the clinical case, let us look at how rare this disease is. Most oncologists will never encounter esophageal MiNEN during their careers. Because of its rarity, diagnosis and treatment remain challenging. Even the largest published studies include only a small number of patients. MiNEN is one of the most challenging diagnoses in gastrointestinal pathology. The diagnosis requires convincing evidence of two independent tumor components, confirmed by both morphology and immunohistochemistry. In routine biopsy specimens, this is often difficult because only a small portion of the tumor is available for examination. From a clinical perspective, there are currently no dedicated treatment guidelines for esophageal MiNEN. Asa result. Therapeutic decisions are usually based on the biologically dominant tumor component. The terminology has changed over the past decade. Earlier classifications used the term MANEC. Today, the World Health Organization recommends the term MiNEN. This terminology better reflects the biological diversity of these tumors. Standardized terminology improves diagnosis and comparison between studies. The patient was a 58-year-old man that he presented with heartburn lasting 1 month. Endoscopy revealed an exophytic tumor in the lower esophagus. CT showed localized wall thickening without lymph node or distant metastases. The clinical stage was CT2N0M0, stage I.At that time. There was no indication that this was such a rare tumor. This was the key step of the diagnostic process. Initial morphology suggested several possible diagnoses. Morphology alone was not sufficient. Immunohistochemistry demonstrated both neuroendocrine and squamous differentiation. CD56, P40, and the high key 67 index supported the diagnosis of MiNEN. This result completely changed the clinical management. This slide illustrates a key stage of the pathological evaluation. The HNE section demonstrates the squamous component. CD56 indicates neuroendocrine differentiation. However, CD56 alone cannot establish the diagnosis. Every immunohistochemical marker must always be interpreted together with morphology. At this stage, it became evident that the tumor was not a single histological entity. The P40 staining confirmed squamous differentiation, while the markedly elevated key 67 index demonstrated the highly proliferative nature of the neuroendocrine component. Together, these findings strongly supported the diagnosis of MiNEN. The final diagnosis was established after combining morphology and immunohistochemistry. Synaptophysin confirmed neuroendocrine differentiation. At this point, the diagnosis of MiNEN was clear. The next challenge was choosing the optimal treatment strategy. Following confirmation of the diagnosis, the major clinical question concerned treatment selection. Should therapy follow established protocols for esophageal squamous cell carcinoma, or should it be based on the principles used for high-grade neuroendocrine carcinoma? Because no specific guidelines exist for esophageal MiNEN, treatment should be based on the biologically most aggressive tumor component. Radical R0 resection remains the cornerstone of treatment for localized MiNEN. However, treatment sequence is equally important. If high-grade neuroendocrine carcinoma predominates, platinum-based chemotherapy is usually recommended first. Surgery is performed after reassessment of response. If squamous cell carcinoma predominates, treatment follows standard esophageal cancer guidelines. Therefore, surgery depends on tumor location, whereas treatment sequence depends on tumor biology. This case highlights the importance of accurate pathological diagnosis in rare esophageal tumors. Expert pathology may completely change both diagnosis and treatment. Patients with suspected MiNEN should be discussed by an experienced multidisciplinary team. Thank you for your attention.